Joined now by Republican Congressman Mo Brooks of Alabama, who is a member of the House Freedom Caucus. But without making an assumption of where you stand on this bill, let me ask you, where do you stand on the House leadership repeal and replace bill, sir?
Well, good to see you this evening, Chuck.
Nice to see you, sir.
I'm undecided. I am still trying to examine it and try to figure out if there are more pros or more cons and where it is on balance. Some key issues to me. How does it affect the solvency of the federal government? As you know, we're headed to a debilitating insolvency and bankruptcy as we soon blow through the $20 trillion debt mark. And then there's a provision in it, according to a summary that I got from the Ways and Means Committee, that suggests that American taxpayers are going to be responsible for giving away money to foreign nationals and qualified aliens, whatever that phrase qualified aliens means, to help them pay for their health care. Well, why should American citizens be absorbing that additional cost when we have such a hard time paying for the health care of American citizens, much less people who are not American citizens? So there are a lot of things that have to be looked through. In short, though, it appears to be the largest welfare program ever proposed by Republicans in the history of our country.
Well, Congressman Brooks, you called yourself undecided at the beginning of your answer. And then, to quote you, it's still the largest welfare proposal that a Republican has ever introduced. So, Congressman, let me ask you again. Are you in favor of this bill or not?
Well, you probably have a pretty good idea from my remarks as to where I'm leaning, but I don't have a Congressional Budget Office scoring of the bill, for example, that tells me what they think the impact on deficit and debt will be. If all of a sudden I'm surprised and this is going to save taxpayers a lot of money, reduce our deficit, make us more solvent as a country, that can persuade me otherwise. Yeah. And as you know, with this administration and this president, it's the art of the deal. If suddenly the package is changed considerably to make it more palatable, well, that can change my opinion somewhat on where I stand. So right now I'm keeping my options open, but there are some major problems with the bill, major hurdles for me to overcome before I can support it.
What do you think the long-term impact would be on sort of where health care goes in this country if a form of this bill is enacted? Because right now, the replacement bill does look like it's going to leave a lot of the Obamacare architecture in place. And
well, if you
so
believe
where
in
do you think this goes? Yeah.
If you believe in socialized medicine, then you ought to be for Obamacare and you ought to be in favor of this replacement, because ultimately this is a huge step in favor of socialized medicine, and that's where we're going to end up. If this legislation passes, by way of example, we're going to have a continual debate from here until eternity on how big the subsidies should be, and that's going to be a campaign issue every year. And over time, I think the subsidies are going to continue to get bigger and bigger and bigger, which in turn means that you're going to have larger and larger deficits, which in turn means that our debt's going to become less and less manageable, which will accelerate the day that our country goes through a debilitating insolvency and bankruptcy that we really ought to do everything we can to avoid.
You know, I have been to your district. I've seen you. You are a fiscal conservative, and nobody would say otherwise. I'm curious, hearing your concern about the debt. Are you concerned that there's now a Republican in the White House that doesn't have that same concern about the debt as you do?
Well, last week, President Trump gave an excellent address to the United States Congress. But the one thing that disappointed me was that there was not one word mentioned about our deficit and our debt and the threat that that poses to our country. And I really wish that that stage opportunity had been used to impress upon the American people the precipice that we face. A precipice that can undo what it took centuries of our American ancestors to build.
Well, does it concern, if he didn't even bring it up in his speech to Congress, doesn't that tell you where it is on his priority list?
Well, I'm hopeful that we'll be able to change that as a priority on the list as it stands right now. But you've got the Secretary of Defense Mattis, you've got a former chairman of the Joint Chiefs of Staff, Mike Mullen, who both have testified or publicly stated that it's our deficit and debt which is our nation's greatest national security risk. So it's incumbent upon people like myself and Mick Mulvaney, who I believe is going to be an excellent director of the Office of Management and Budget, to impress upon the White House that this is an issue that we can no longer set aside. That if we're going to save our country from that debilitating insolvency and bankruptcy, it needs to be the #1 issue with respect to every subject matter that we address. And hopefully we can educate the White House and impress upon them the seriousness of the situation.
All right, let me button up health care here in this respect. Is there one major change that House leadership could make that would say, all right, I'll accept some of these provisions getting in there? It's not my first choice. But what is the biggest thing you'd like to see fixed in this initial proposal?
Well, if we're going to have a Christmas list major change, it would be to repeal in toto Obamacare, then implement market reforms, interstate competition for insurance carriers, eliminate the exemptions from the antitrust legislation, things of that nature, so that competition forces pricing to be something more reasonable that people can afford, and then send it to the states and let the 50 states as incubators decide for themselves what kind of health care system they want. And if they like Obamacare, New York, Massachusetts, California, they can pass Obamacare, provided they can pay for it.
Congressman Mo Brooks, Republican from Huntsville, Alabama. As always, sir, thank you for coming on and sharing your views.
My pleasure, Chuck.